Not long after Bruce Rauner was elected governor of Illinois in 2018, he began the process of filling appointed positions. To lead his Department of Public Health, he chose someone spectacularly unqualified for the role. Dr. Nirav Shah completed medical school in 2008, then spent 6.5 years working as an attorney before being nominated. He had never practiced medicine and never held a medical license. His nomination biography from the Rauner administration noted only 2 jobs in Shah's background, one as an economist, the other as an attorney. Shah was remarkably underqualified for the position, and it would soon show with deadly results. Krabbe disease is a degenerative neurological disease, which can be treated only if caught within the first weeks of life. To improve the survival rate, the Illinois legislature passed a law requiring the Illinois Department of Public Health, IDPH, to begin testing babies for the disease. 3 years into his term, Shah had failed to abide by the law. The Tribune found at least 5 Illinois babies were born with Krabbe after the screening was supposed to be in place. None was able to receive a transplant because their conditions weren't caught at birth. 3 of them have died. State Representative Mary Flowers, a Democrat, is the chair of the House Health Care Availability and Access Committee. She decided to schedule a hearing to allow parents whose children had died from Krabbe since the law passed to tell their stories directly to Shah. Flowers had another motive. Quote, "I need to know what is it about that law that we passed that the agency doesn't think they have to implement it."
You and your department for the last 10 years have made us all sick, and you caused the death of our children.
Unfortunately, this was not the first time that Shah was called before a legislative committee and asked to explain his role in the deaths of Illinois citizens. 2 months earlier, on August 21, 2015, Shah was notified by the Illinois Veterans Home in Quincy that a resident had been diagnosed with the deadly waterborne virus known as Legionnaire's disease. The following day, the facility notified Shah of a second case. Shah notified the director of the Illinois Department of Veterans Affairs, IDVA, that his team is investigating. IDVA director responds saying the situation needs an immediate response mode and getting it under control.
We need to take extra precautions to ensure that this does not go beyond these 2 cases. If we need to get people out there this weekend to test the water and make sure people are safe, then let's do it now. I do not want someone else to get sick.
Shah emails the IDVA director downplaying the seriousness of what is now an outbreak.
While this situation is serious because it involves lives, it is not unprecedented or atypical. Legionella is a risk in any situation of this sort. Fortunately, Legionella is a disease we know how to diagnose and treat. And from an epidemiology standpoint, we know how to track it down.
Day 4, midday. Nearly 3 days after the second diagnosis, 67 hours, Shah finally sends staffers to the home to investigate. A state audit later concludes, based on our review of communications between IDPH and the Quincy Veterans Home, state auditors determined that there was limited communication between IDPH management and the Quincy Veterans Home staff. Shah and his staff often did not know the seriousness of the problem at the Quincy Veterans Home. Shah emails, "I honestly didn't realize that so many other residents and employees at the facility are ill." Day 4. By that night, 18 people had been admitted to the hospital with pneumonia-like symptoms. By the end of the outbreak, 12 veterans who lived at the Quincy home had died of Legionnaire's disease. In the months and years that followed, multiple investigations were conducted to determine how this could have happened. All of them pointed a finger of blame at Shah.
Ex-state health director dismissed need to alert CDC early in Legionnaire's outbreak that eventually killed a dozen people. The audit of the state's handling of Legionnaire's cases at the Civil War era home found that Shah dismissed the need for having the CDC visit the facility on the 8th day of the outbreak that began August 21, 2015. In an email at the time, Shah said he didn't think it's necessary right now, despite 2 deaths and dozens of illnesses already having occurred, the audit found. But Nirav Shah, public health director in former Governor Bruce Rauner's administration, defended the agency's handling of the outbreak, saying, "We followed exactly the guidelines from the Federal Centers for Disease Control and Prevention on how states should respond to Legionnaires in a facility setting."
An exhaustive search found no U.S. CDC guidelines that suggest not acting even after patients have died and dozens are seriously ill. Not only did Shah not follow CDC guidelines, but when another outbreak occurred in 2018 and the CDC returned, they found that their recommendations from 2015 had still not been implemented.
IDPH staff interviews revealed that patients were not removed from rooms when flushing was performed, despite being recommended in the 2017 CDC report.
The audit said that by the time Shah relented to have the CDC called in, the agency didn't arrive on site until the outbreak's 12th day. By then, 7 people had died and 37 others had become ill.
In all, 12 veterans died as a result of the outbreak, and the state paid $6 million in settlements to their families. The audit was just the last in a line of investigations by either government agencies or the media. It became necessary, not just because of the public outcry, but by Shah's refusal to turn over documents in the case. The Illinois State Attorney General announced a criminal probe of the state's response to the outbreak that included Shah and his department. As these investigations revealed more and more information, the call for Shah to resign spread across Illinois government and politics. Members of both parties, both houses of the legislature and the U.S. Senate all joined in.
McCann has also called for the Director of Public Health, Nirav Shah, to step down.
The person who should resign is Director Shah.
Lawmakers want State Public Health Director Nirav Shah to resign over Legionnaire's outbreaks at the Quincy Veterans Home. The illness is linked to 13 deaths there since 2015.
When new emails came to light showing Shah had not acted on the botched repair of the water system at the home that led to the outbreak, Illinois' 2 U.S. senators, both Democrats, Dick Durbin and Tammy Duckworth, herself a veteran, again called for Shah to resign. When committees in the Illinois legislature asked Dr. Shah to attend meetings and answer questions about the veterans' home outbreak, Shah simply did not show up. When lawmakers asked Shah to provide documents, including emails, related to his actions concerning the outbreak, he told them they would have to request them under the Freedom of Information Act. When Shah finally appeared before a legislative committee, he was asked about the records. He continued to stonewall.
Simple answer. Why won't you share the emails, Director?
But answers were hard to come by. Lawmakers pressed for transparency were told they needed to file a FOIA request to see emails between the governor, the Department of Veterans Affairs, and the Department of Public Health during 3 outbreaks of Legionnaire's disease.
We will share the emails.
When?
When Senator Cullerton's office and the governor's office and our agencies sit down, narrow the scope of the request so that we can provide precisely what is responsive.
Some lawmakers say the Rauner administration is playing a game of hide the ball.
I've never had to go through where I actually have to formally request a FOIA from one of our own agencies.
This frustrates me because we're trying to get answers.
Chairman of the Veterans Affairs Committee, Senator Tom Cullerton, says someone needs to be held accountable.
Who knew what, when they knew it, why the response took so long, and then going forward, what they're actually going to do to accomplish and not let this happen again.
When lawmakers filed the request, this is what they got in return. Files so heavily redacted, many were completely unreadable. The Illinois State Auditor, however, has legal access to the documents in question and conducted a full audit of the actions of state government in regard to the Quincy outbreak. The audit's findings were highly critical of Shah and his handling of the outbreak. Most damning were conclusions that Shah repeatedly failed to act as the outbreak unfolded.
The Illinois Department of Public Health, IDPH, did not go on site at Quincy Veterans Home until midday on Monday, August 24th. That was nearly 3 days, approximately 67 hours, after the second case was confirmed late in the afternoon on August 21st.
The audit also revealed that Shah knew of the outbreak but waited 6 days to contact the U.S. CDC. While he waited, 2 veterans died and dozens more became ill. This was confirmed by investigations by the Attorney General, State Auditor, and local media. The state audit revealed that poor communications from Shah and his department to the leaders of the veterans' home may have contributed to the crisis, and that, even after he was aware of the outbreak, Shah downplayed its importance to the Director of Veterans Affairs.
Based on our review of communications between IDPH and the Quincy Veterans Home, auditors determined that there was limited communication between IDPH management and the Quincy Veterans Home staff. As identified in our timeline, IDPH officials often did not know the seriousness of the problem at the Quincy Veterans Home.
The state audit revealed that, even after he was aware of the outbreak, Shah downplayed its importance to the Director of Veterans Affairs. As more and more information about Shah's role in the outbreak became public, more and more government leaders in Illinois called for his resignation, sometimes in very pointed language.
Quite simply, Director Shah must step down immediately in light of these recent reports.
Director Shah's response to this tragedy reflects the height of irresponsibility and negligence, and it's time for him to go.
You, sir, disgust me. I have called for your resignation, Dr. Shah, and I call for it again, and if you won't provide it, I will call on the governor to relieve you of your duties.
Your best is not good enough, Dr. Shah. It's atrocious. Where's the plan? I'm tired of band-aids. I'm tired of excuses. The fact of the matter is that you are inept. I agree with Senator McCann. You should resign.
We're really on top of the situation.
Despite the overwhelming outcry over the deaths, Shah refused to resign. Then, in 2018, Governor Rauner was up for re-election, and the Legionnaires' crisis became a major focal point of that campaign. The Illinois Attorney General launched her own investigation, including criminal subpoenas, and announced her intentions on the eve of the first televised gubernatorial debate.
And the first question is for Governor Bruce Rauner, and it comes from Craig Wall. Craig.
Governor Rauner, recently released emails show that your office delayed in the reporting of the Legionnaires' deaths at the Quincy Veterans Home in 2015. Now Lisa Madigan, the Attorney General, has launched a criminal investigation. Was there a deliberate attempt by your administration to hide what was happening at Quincy?
On the night of the debate, family members of those who died at the Veterans Home gathered to watch. They had a lot to say to the press.
All the families is that there's still raw anger about how they weren't told of the outbreak sooner, even though Governor Bruce Rauner's administrators knew they had an epidemic on their hands.
Do they think we're all stupid? I mean, here they are not telling us for 6 days, and our family members are in there. We could have had a choice, people. Yeah. We could have took our fathers and mothers out. We could have got them other help, and they had the audacity not to tell us for 6 days. Some of us longer.
In a secret email, Shah hoped a flattering news story helped rebut criticism from a family member of one of the veterans who died at Quincy.
Today, Illinois' public health chief is apologizing for his email about a state veterans home resident who died from Legionnaire's disease. WBEZ's Dave McKinney reports.
Lawmakers want State Public Health Director Nirav Shah to resign over Legionnaire's outbreaks at the Quincy Veterans Home. The illness is linked to 13 deaths there since 2015. Shah's mea culpa on Illinois public media's The 21st came after being read a secret email uncovered by WBEZ. Shah wrote how a flattering news story helped, quote, rebut a letter from the grief-stricken son of a U.S. Army veteran who died from Legionnaires in 2015.
My particular email that you read was insensitive, and that's not something that I'm proud of. And that's not something I should have communicated in that fashion.
Shah said he has no plans to resign. Dave McKinney, WBEZ.
The day before the election in which the people of Illinois voted Governor Rauner out of office, WBEZ, the radio station whose investigative reporting had revealed many of the details of Shah's disastrous term in office, dropped one last bomb. The Rauner administration finally released more than 132,000 documents to WBEZ radio that had filed a FOIA request for them. One of those documents was an email from Shah, stating that he knew the Quincy Veterans Home had bungled a water system repair in violation of state health codes but chose not to cite the facility for a mistake that likely contributed to the fatal Legionnaires' outbreak in 2015. U.S. Senators Duckworth and Durbin again called on Shah to resign, saying, quote, Dr. Shah's response to this tragedy reflects the height of irresponsibility. But it was too late. Thanks in part to Shah, Rauner lost his re-election bid and Shah was finally out of a job. For a few months at least. On the same election day that Rauner was voted out of office, Janet Mills was voted in as governor of Maine. Not long afterward, Jean Lembrou, newly appointed commissioner of Maine's DHHS, nominated Shah to serve as director of Maine's CDC, claiming that Shah's record in Illinois, quote, includes successes in responding to the opioid crisis and improving the health of children. Apparently, Lembrou never looked into Shah's background, as a simple internet search would have revealed his 3 years of negligence ignoring the Illinois state law on Krabbe disease. Shah's successes in children's health included this exchange that led Shah to issue an apology for his failed leadership.
You and your department for the last 10 years have made us all sick, and you caused the death of our children.
Shah's successes on opioids. During a television interview as he began his 4th year in office, Shah described his success with opioids in his own words.
In the past 3 years, deaths attributable to these fentanyl synthetics have gone from around 90 deaths to over 900, a 10-fold increase in just a few years.
Again, this information is easily accessible on the internet, including numerous articles and videos on his role in the Quincy Veterans Home outbreak. At his first ever meeting with the Maine state legislature, Shah was asked about the Legionnaires' outbreak and claimed he made the facility aware of the outbreak within 27 minutes.
In the case of the Legionnaires' disease outbreak in 2015, my agency notified the facility in 27 minutes.
This statement conflicts with the public record. The timeline created by the state audit shows no 27-minute notification. It does show, however, that the Veterans Home notified him of the outbreak, not the other way around, after which he waited 67 hours to act. State auditors could find no evidence that Shah did anything substantive to prevent further infections and limit the outbreak for at least 6 says.
Although notification of the outbreak was identified and reported timely to IDVA and IDPH by the Adams County Health Department, auditors could not identify any notification of a confirmed outbreak, water restrictions, other than bathing restrictions in the bathing facilities where the first 2 positive cases originated, or procedures implemented to decrease exposure to residents and staff for 6 days.
In contrast to Shah, here is what the director of the Illinois Department of Veterans Affairs did on day 1.
IDVA director emails senior staff and notes, "We need to take extra precautions to ensure that this does not go beyond these 2 cases. If we need to get people out there this weekend to test the water and make sure people are safe, then let's do it now. I do not want someone else to get sick."
Where Shah had been spectacularly unqualified to serve in the role he was given in Illinois, he was even less qualified for his new job in Maine because he had proven in remarkable fashion his deadly and disastrous inability to successfully lead a government agency. Despite Commissioner Lambrew's praises regarding Shah's work improving children's health, and his own experience in ignoring Illinois state law on the matter, he has done nothing while in Maine to add Krabbe's disease to the list of mandatory testing for newborns. Shah brought other bad habits with him from Illinois. After a wedding in Millinocket resulted in an outbreak of COVID-19 among the guests, Shah appeared on numerous media outlets declaring this a superspreader event that led directly to outbreaks all the way to southernmost Maine. When the entire Senate Republican caucus signed a letter to Shah pointing out the errors in his public statements about the event, including placing it in the wrong county, Shah simply ignored the letter. When they sent a second one, he ignored that as well. Shah continually mentioned the wrong number of guests at the wedding, and made much of its apparent connection to a nursing home, 2.5 hours away. Shah appeared numerous times in the media, explaining how he had made this connection.
I'd like to take a second to dive into Maple Crest a bit, just to provide a glimpse as to how quickly this virus can travel. Here's how Maple Crest unfolded. A guest who attended the wedding on August 7th infected their parent. The parent then had contact with another one of their children. That child, that person, works at Maple Crest and infected 5 people at Maple Crest, 4 residents and 1 additional staff member. And all of this unfolded in approximately 2.5 weeks.
A week later, Shah appeared on his daily COVID briefing with a new theory. Watch, as he makes a child disappear from his chain of events without any explanation for the change.
One of those individuals was the secondary contact of a guest and happens to be a staff member at Maple Crest.
Shah shared this second theory during numerous appearances on national media, including CNN.
One person had contact with another person who worked at a nursing home, which generated its own outbreak. So we now have a more sharp focus and recognize that what was 3 seemingly previously disparate events are actually just one large interconnected event. One individual was connected with another person who happened to work at a nursing facility. The person who attended the event passed it on to another person. That person worked at a nursing facility.
Despite his multiple theories and his repeated explanation of them, none of Shah's scenarios is accurate. The worker he said was responsible for carrying the virus from the wedding to the nursing home attended the wedding themselves. His scenarios involving children and parents were all nonsense. Having elevated his so-called superspreader event to national status, Shah's false theories demonstrate that he had little idea what had really occurred, though this didn't stop him from broadcasting his unfounded theories nationwide. Making matters worse, evidence indicates that Shah was aware that his multi-person theories were false, but he kept on repeating them. On September 4, 2020, inspectors from the Maine Department of Health and Human Services, which includes Shah's DHHS, were at Maple Crest investigating their outbreak. They interviewed what they called CNA number 1, which they determined to be the first person there to test positive for COVID. This person had attended the wedding. If CNA number 1 contracted COVID at that wedding on August 7, it was not through a child to a parent to another child over 2.5 weeks, as Shah described, but rather directly at the event and 5 days before they took what turned out to be a positive COVID test. These details were available to DHHS staff as early as September 4, when they interviewed CNA number 1. Shah continued to espouse his multi-person theory as many as 13 days later, indicating that either staffers in his own department did not share such critical information with him about the largest event in the state during a worldwide pandemic, or he knew about CNA number 1, and continued to push his false theories weeks afterward. In a US CDC publication dated 2 months later, a group of scientists, including some on Shah's staff, published a report about the wedding and its theoretical impact on other outbreaks. Among their conclusions was that, quote, a definitive linkage of outbreaks at these facilities to the event was not possible in the absence of whole genome sequencing. And that, quote, staff members at Maple Crest possibly had exposures outside the facilities. Despite Shah's definitive and repeated statements to the contrary, his own scientists concluded that there was no way to prove a connection between the wedding and Maple Crest, and that the infection at Maple Crest may have come from another source. Though perhaps the most significant, Shah's response to this event was hardly the only situation where his statements were at odds with the facts. March 25, 2021. Shah lies to Mainers about nursing home deaths.
We have gone more than 30 days in Maine without a single death that we are aware of COVID from COVID-19 in a long-term care facility.
As Shah is well aware, it takes almost no time to check this data and see if this statement is accurate. It wasn't. Federal data, provided directly by nursing homes and available to the public in an easy-to-use online database. Using this website, it takes less than 2 minutes to verify the statement. The result: there were at least 6 deaths during the period Shah claimed there were none. In a recent magazine interview, Shah admitted his penchant for providing bad data to Mainers. He has cut back on daily briefings, he said, quote, because he recognized that each one was an opportunity to screw up. Said Shah, quote, you're always this close to the line of completely saying something that gets you fired. Then there was the time in September 2021 when Shah was asked how Maine suddenly led the nation in the 14-day growth in new COVID cases. Shah floated the bizarre theory that a spike in COVID cases in Maine was caused by a hurricane in Louisiana. When a reporter asked how it was that Maine led the nation in the growth of COVID cases, a suddenly nervous Shah dodged the question by claiming that Maine moved up because 5 states affected by Hurricane Ida had fallen off the list, making room for Maine to move up. 3 of the 5 states that Shah mentioned suffered little or no impact from Ida and, as a whole, the region did not show a drop in cases during the 7 days around Ida's appearance. But the reporter had not asked about overall case rates. She specifically asked about the 14-day growth in cases, a category in which Maine then led the nation. Even if this had been an answer to the question, Shah was provably wrong. His explanation was that the hurricane caused a suspension of testing in the 5 states and therefore fewer cases were reported. Easily accessible data, however, shows that none of these states saw drops in cases over more than 1 or 2 days, and none of them fell out of the top 10 states for cases. Also, Maine never appeared in the top 10 of this separate category. Shah's answer, though strange and factually wrong, is understandable, because Maine's suddenly highest in the nation growth in cases demonstrated that either something other than government policy was driving the pandemic, or that Maine's policies were failing worse than those of any other state. Shah's willingness to put forward misleading and false information in answer to a reporter's question is a dangerous thing for the chief provider of COVID data to do in the midst of a worldwide pandemic. Nevertheless, many of Maine's institutions of higher learning have condoned, even championed Shah's behavior both in Maine and Illinois by bestowing honorary degrees upon him, and holding him up as an example of excellence for their graduating seniors. By choosing Shah as a commencement speaker, Bates College, University of New England and the University of Southern Maine all sent a message to their students that celebrity is more important than substance. Footnote. In what must be the most bizarre aftermath of Shah's involvement in the deaths of 12 veterans at the Illinois State Veterans Home in Quincy, there is this. This is a photo from Down East magazine of Shah and his golden retriever. The dog's name is Quincy.